Every precaution has been taken for the protection of the presenters and crew during this live event. All COVID regulations have been adhered to and additional health and safety measures are in place. We hope that you enjoy the show and that you're staying safe wherever you may be.
Good morning, Sanbonani, Dumelang, Lochani, Huyemwere, and welcome to the annual general meeting of Bonitas Medical Fund. My name is Dustin Gwane, and I am the chairperson of the board. The AGM is the ideal time for us to engage with our members, and we thank you for joining us and participating. We have taken all precautions to ensure a COVID-safe environment for today's proceedings, including regular sanitizing, COVID-19 screening, and social distancing. The panel will be wearing their masks for the duration of the proceedings, only removing them when speaking for their specific sections of the AGM. In terms of Rule 26.1.1, the annual general meeting of the scheme shall be held by no later than the 31st August of each year. Due to the COVID-19 pandemic and the lockdown restrictions, the board has resolved to hold a virtual AGM for 2021 to ensure our members were kept safe. The notice of the AGM was circulated to all members through various mediums of communication to encourage participation. Further, in terms of Rule 26.1.3, at least 20 members of the scheme present at the AGM constitutes a quorum. With this being said, I would like to ask Boitumelo Likoko of PwC to confirm if the meeting is correct before proceeding further. Over to you, Boitumelo.
Thank you, Chair. Good morning, ladies and gentlemen. The scheme has appointed PwC as the independent oversight body in order to monitor the activities of the AGM and also the activities in respect of the electronic voting. The first order of the day, as the Chair has indicated, is to determine whether or not we have got a quorum. And Chair, I would like to read that rule again. At least 20 members of the scheme present at the AGM constitute a quorum. Chair, based on the live streaming platform, I would like to confirm that we have 209 members that have logged onto the platform as at 18 August, 3 minutes past 9. And Chair, with that being said, there are more than 20 members in attendance, and therefore PwC, as the independent oversight body, confirms that the meeting is correct. Chair, before I hand over to you, I would like to remind members that voting remains open and it will be closing today at 4 p.m. And also just to remind members that there are 2 resolutions to be voted on, and that is according to the agenda. And those resolutions are to confirm the appointment of Deloitte & Touche as the scheme's auditors for the 2021 financial year, vote in respect of the proposed amalgamation with Net Group Medical Aid Scheme. And also, members, there are 4 platforms in which you can vote on. This is the member portal, the USSD, the e-voting, as well as on WhatsApp. Chair, with that being said, thank you.
Thank you, Boitumelo. Our agenda, as per the scheme rules, the notice convening the AGM was circulated to members 21 days prior to the date of the AGM. I confirm that the agenda items remained as contained in the notice sent to members. These are to receive and note the Board of Trustees report for the year ended 31st December 2020. 2, to receive and note the independent auditor's report for the year ended 31st December 2020. 3, to receive and note the audited financial statements for the year ended 31st December 2020. 4, to confirm the appointment of the auditor for 2021. To vote in respect of the proposed amalgamation with the Net Group Medical Aid Scheme, that was point 5, and point 6, to consider any other matters of which due notice has been given in terms of the scheme rules. I confirm that no further matters were received. Please be advised, members can raise questions via the platform, which I will address during the AGM proceedings. In terms of the overview, I will now take you through the overview of the governance structures of the scheme. The Board of Trustees consists of the following: myself, Dastingwane, as the chairperson, the second trustee, Jonathan Berg, the vice chairperson, the third trustee, Advocate Lugin Koch, the fourth trustee, Maria Lisunyane, the fifth trustee, Mbengeni Nechisawulu, the sixth trustee, Pire Ribbons, the seventh trustee, Rodney Cowling, the eighth trustee, Jackie Asher, the ninth trustee, James Fenter. Bonitas convened a special general meeting on the 14th April 2021 for the purposes of holding elections to fill 2 vacancies that arose on the Board of Trustees. I would like to welcome Opa Komane and Dr. Peter Hill to the Board of Trustees. Our duty in terms of the medical schemes are governed by the Medical Schemes Act 131 of 1998. The scheme rules are approved by the Council for Medical Schemes, and the rules are available on the Bonitas website. Section 57(6) of the Medical Schemes Act requires the Board of Trustees to take all reasonable steps to ensure that the interest of beneficiaries in terms of the rules of the medical scheme and the provisions of the Medical Schemes Act are protected at all times. Act with due care, diligence, skill, and good faith. Take all reasonable steps to avoid conflicts of interest and act with impartiality in respect of all beneficiaries. Bonitas also subscribes to the principles of good governance, including those contained in the King's 4 report on corporate governance, insofar as they are applicable to medical schemes. The governance structures and framework in assisting the board in carrying out its mandate, 5 committees were established, namely, the first one, Audit and Risk Committee, the second one, Remuneration Committee, the third one, Investment Committee, the fourth one, Working and Strategy Committee, and the fifth one, Managed Healthcare Committee. These committees function with a defined mandate with regular feedback to the board. Mr. Lee Kalakopen remains in the position of Principal Officer, and Mr. Luke Woodhouse remains in the position of CFO. Item number 2 on our agenda, the Board of Trustees report. I would like to invite the Principal Officer, Lee, to share with you the highlights of the Board of Trustees report. Lee, over to you.
Good morning, everyone, and thank you very much, Chairman. Ladies and gentlemen, I am pleased to present the Board of Trustees report for the financial year ending 31st of December 2020. However, before I start, I would like to take a minute to express our condolences as Bonitas Medical Fund for those family members that we have lost as part of Bonitas Medical Fund. Our thoughts are with you during this difficult time. Second of all, the year that has passed has been a very unusual year for all of us, something that we never anticipated. And to that end, we also wish to thank the frontline health workers that has been attending to our members in hospitals, in home settings, etc. We thank you for your courage, and we thank you for your service looking after our members. Also to the scheme structures at large, the Board of Trustees, our service providers, where we had to adjust our way of work in terms of being able to ensure that we are able to still discharge ourselves of our duties and to act in the interest of our members at all times, as what has been alluded to by our chairman of the board. With that said, going into the first portion in terms of our brand promise, which really speaks to the point that I shared a few seconds ago, and that is to always ensure that Bonitas Medical Fund remains financially sustainable for its members and to meet the needs of our members. The last 18 months has clearly shown the importance of healthcare and the needs that was required from all stakeholders during this time to come together in the spirit of Ubuntu and to carry our country forward. Clear strength in terms of leadership was required. The second aspect, which was once again amplified during this time, as is the case all the time, but more so during the COVID pandemic, and that is to ensure that we make quality healthcare more affordable and particularly more accessible. As hospitals started filling up and social distancing protocols was implemented, accessibility remained a key focus for us as a medical scheme through our various governance structures and with our service providers. And that is clearly speaking to the heart and the philosophy that we drive in terms of our behavior as Bonitas Medical Fund. That is to create accessibility for our members. In relation to that, our value proposition remains steadfast. Even during these times, it's very unusual for us. And that is financial sustainability or financial stability, as you would see to the top right-hand corner of the slide. Financial stability has been a key challenge, especially in light of the uncertainties that we faced. The uncertainty that we faced in terms of what the cost of COVID would be. However, that was just an underlying principle that we had to have top of mind during this time. Like I've mentioned, accessibility was the key aspect for us during this time. Finding innovative ways as part of our strategy to ensure that there's accessibility for members through things such as virtual consultations, which I'll speak a little bit later on in my presentation, was also key for the board as well as the executive and the associated service providers throughout the value chain. Affordability during this time, as what we've experienced as a result of COVID, where the economy was impacted quite severely, which our CFO Luke will speak a little bit later on, is also an aspect that we continuously focus on. And that is to ensure that our range of options that provides benefits to members is as affordable as best possible. A challenge that is not easy to maintain during these uncertain times, but something that we are clearly committed to throughout the partners within the Bonitas Medical Fund. That is to ensure that our scheme is stable and remains or provides options that's affordable. Taking care of our members during this time is non-negotiable. We appreciate the trauma of the experiences that members are facing. And it is being able to connect with our members at that level to show that we truly understand the issues that we are all facing. Partnering with service providers, as I've mentioned, and as I express my thanks and appreciation to everybody that came together to be able to ensure that we are able to still maintain the highest level of service and expectation towards our members. Where are we currently in terms of, from a Bonitas perspective, in terms of from a overview perspective? If you look at it from a membership, our pensioner ratio currently at 10.2%. Our dependence is at 1 to 1.13. Our chronic profile is currently at 19%. Our non-healthcare expenditure, which Luke will allude to in more detail, and I will also give a breakdown in terms of how member funds are applied, is currently at 8.9% at the financial year, obviously ending 2020. Our average age of our beneficiaries at 35. And once again, I will share later on in my presentation why these indicators are of critical importance. Also, we finished the year with a total membership of 333,141, with a total beneficiary of 710,157. If we move on in terms of how those numbers were achieved from a quantitative perspective, it is informed by a solid strategy that I've reported on at previous AGMs. However, as a result of the dynamics that we experienced, we had to adjust our strategy accordingly in terms of the detailed operational plans or tactical plans. However, at large, our strategy in terms of the key pillars remains unchanged, and that is to be a strategic partner, to boost our business development in terms of membership growth, to care for our members, to connect with all stakeholders, members and patients, to integrate our value chain to ensure that we remain financially stable and sustainable, to creating value through innovation, and as I mentioned earlier on, innovation, whether it is people, process or systems, remain key to ensure that we navigate the challenges that we experienced over the last couple of months. And I'm sure that there is more to come. However, we remain robust and resilient in terms of how we apply ourselves to ensure that we navigate any challenges or windfalls that we may be experiencing or that we will be experiencing. Optimizing investment returns and governance remains central to everything that we do across all our strategic initiatives, which Luke will also touch on a little bit later on. Let me start off with reporting to the membership in terms of business development and membership growth, how we've been navigating the landscape over the last 12 months. As I've mentioned, COVID had a severe impact from a macroeconomic perspective, and Luke will touch on that a little bit later on. But what the graph or the presentation is illustrating now to you is that membership declined relative to the entire private healthcare market. As you can note from the slide, we have seen ranges of membership loss ranging from minus 1.6% to up to just under 7%. Bonitas, on the left-hand side, has been fortunate enough through the initiatives that we've embarked on and our strategies to only have a relative small decline of 1.7%. One scheme, however, stood out with a membership growth of 2.4%. That could be as a result of amalgamations or mergers that actually gave them that boost. So relative to market, we were able to mitigate the potential decline that was impressed on us as a result of the broader macroeconomic aspects, such as retrenchments, affordability, short salary payments, etc. And as I indicated in the member overview slide to the left, and you can see in terms of what that membership meant for us at the end of the financial year. However, I'm pleased to say that we were able to turn that around during the course of this year. And as you can see, as at the 13th of August, our membership has grown from the 333,000 members to 341,000 members, which once again is illustrative of a very solid sales and marketing strategy and bringing everything together from a systems process. And when I say systems, an integration of all systems in the value chain that yields the positive membership growth for us. We have also seen in terms of our dependence per member, that increasing, which is also positive for us in terms of our contribution income. But more pleasing is that our average age has actually remained very stable. Now, average age is quite important in relation to how we price and the type of contribution increases we can afford. And this has remained stable, keeping in mind that our members and beneficiaries increase by at least 1 year every single year. But from a business development perspective, what it implies is that we were able to attract younger members into the scheme, which is quite important, as you'll see further on in my presentation. Further to that, from a business development perspective, as I've mentioned, we have seen an increase in membership during the course of this year, turning that negative growth that we experienced last year around. And we have seen a total of 35,000 new members enrolling year to date onto Bonitas Medical Fund, which speaks volumes around our strategy in terms of understanding the cost of private healthcare. Second of all, in terms of understanding the benefits and the needs that members require. Further to that, the appeal and the call to be mindful around the cost of healthcare, bringing that down. We also announced, where possible, in certain of our options, 0% increases in terms of contribution, as was the case in one of our options, such as Bonfit, which was very well received by members. Further to that, if you look in terms of the top right-hand corner, plan stability, once again, is illustrative of how we apply ourselves in understanding the benefit, the design, and the pricing. And to that point, 96% of our members have remained on their plans, which once again is illustrative or indicative for us as we consider in terms of the needs of members, that members are satisfied with their type of options and benefits under the prevailing circumstances that we faced. About a year ago, when we sat and we announced our last financials at the previous AGM, we spoke about the solvency level of 24.9%, which was just slightly below the regulatory requirements. And very pleased to say that we ended off the year at 32.7%, which to you as a member is indicative of a very healthy organization when it comes to having reserves available to pay future healthcare costs. And that solvency was reported at 32.7%. In terms of creating value for our members, this is a key point that is constantly in our deliberations as a board, as an executive team, and with service providers, because we need to ensure that we always act in the interest of our members by demonstrating greater value in terms of what you pay for, in terms of your contributions. We want to also proactively safeguard members' interest in terms of the assets that we have available, so to ensure that, as it was the case with COVID, that when pandemics or unforeseen situations arise, that we are well positioned to cover that cost for our members. That is quite important in terms of how we go about protecting that value through integration, structured and comprehensive approaches in terms of our product and benefit design, customization where required in terms of understanding the needs of specific segments of our membership base, and inclusivity in terms of engaging with our broker communities, with the Council for Medical Schemes, with hospital groups, to understand truly what their needs and wants are, to be able to formulate plans that is customized, as what I've mentioned in one of the key points in terms of delivery, the type of results that you will see. I won't touch on every single point, but this clearly gives you an indication or illustrative of how we approach in terms of safeguarding the interest of our members and ensuring that the scheme remains sustainable at all times. A key question that is constantly asked towards us and in previous AGMs and engagements is, how is money applied to members? And the slide is illustrative of showing how we create value and where money is being spent. First of all, the main income for the scheme is through contributions, your monthly contributions towards the option that you have elected to be on. That is either through main member contributions and beneficiaries. Out of that money, first and foremost, is to cover healthcare costs through claims. And as you can see, a total of 83% of all contributions that we collect goes towards healthcare costs and claims that is submitted to us on a daily basis, an hourly basis. The year that has passed, of course, we had to spend quite a bit in terms of COVID cost, and 6% of total claims compromised out of COVID, and the rest out of non-COVID. Once that money is paid, the 83%, cost goes to admin, managed care. So admin cost is inclusive of all overhead costs and administrative fees. And then, of course, for those members that have got brokers, 1.8% of your contributions goes towards broker cost. So this is how contributions are applied in terms of their healthcare needs. Let's bring that down to rands and cents, because percentages can be sometimes misleading. So for the reporting period, close to 5.8 billion rand was spent towards hospitals in terms of members seeking healthcare. 974 million rand was spent towards COVID, an astronomical 1.2 billion rand towards costs such as cancer treatment, cardio, pneumonia, hip and knee, to name but a few. To the right-hand side, on chronic, which is quite key, we always hear about comorbidities when we hear international reporting and even national, especially under the COVID pandemic, where we've heard in terms of how comorbidities impact members. The scheme spent 771 million rand towards managing chronic proactively, or members with chronic diseases more proactively. And I'll touch a little bit later on in one of the other key strategic pillars why that is important. In terms of day-to-day benefits, 950 million rand was spent. But what is also key is really the bottom right-hand indicator. If you look in terms of any members claiming more than 500,000 rand per event, we spend on close to about 1,779 members. So just to simplify it, 1,779 members had an event or claim that cost the scheme 500,000 rand or more. So this is how the cost, your contributions, is applied relative to healthcare costs and claims in relation to the previous slide that I shared. But Luke will unpack that more in terms of the financial indicators when he gives the financial report. In terms of managed care programs, we accept that members will have a healthcare event, and it's important for us as a medical scheme, and in relation to how we actually protect and create value for our members, to be able to intervene and develop managed care programs to ensure members get quality healthcare at the right cost and that accessibility is no challenge. Through our managed care initiatives and interventions, we focus in terms of adding value for members in that regard. During COVID, our focus was to ensure that members have no out-of-pocket expenses when they seek healthcare or support in relation to COVID pandemic. And that is covering things such as the vaccine, ensuring that when a member or a family member went into hospital or day-to-day, that there was a wallet-free experience. And that is through our managed care initiatives. Further to that, if you consider in terms of pathology tests, as people wanted to understand whether they were positive, COVID positive, through pathology negotiations, that actual test and the cost associated with it was to negotiate the best possible and lowest possible costs associated with it, to ensure, once again, the scheme remains sustainable, but the member receives quality, accessible healthcare. To touch on some of the other aspects, because we also appreciated that our healthcare infrastructure needed to remain stable and safe, we proactively engaged with service providers to ensure that they've got the necessary PPE to ensure that they are able to serve our members or patients. And that cost and the access to those things such as PPE would not be a challenge. And we as a scheme proactively engaged in that regard. Other aspects that I've mentioned was things such as virtual care. We're very pleased through the whole discussion around telemedicine, etc., to be able to offer virtual care for our members, where they were able, through a smart device, access a healthcare provider and get some guidance and support. I mentioned earlier on the issue around managing chronic cost. We accept that members will, at some point in time, or some members will face chronic disease challenges. And through our disease management programs, that indicator in terms of ensuring that we manage the chronic medicine cost or any disease-related cost as a scheme, and allied to our objective around ensuring that we actually make our members healthier and improve better quality of life, we have also started focusing in terms of ensuring that that quality of care actually is accessible to members. And what you see on the slide through our managed care programs, we constantly apply our minds through the managed care subcommittee, board of trustees, to ensure that we identify members that has got chronic conditions. And for the reporting period, we have increased our registration of beneficiaries onto our chronic medicine program by 10.5%. Why is that important? Because through research and studies, that members that is enrolled into a chronic medicine program or disease management program, we are able to improve their quality of life in navigating the actual disease. Further to that, in terms of managing the costs associated with it, to ensure that the right quality of care takes place. And that is obviously done in conjunction with service providers, being doctors, hospitals, pharmacies, etc. In terms of our HIV program, we have increased enrollment to 2.9% during the reporting period. Once again, improving the quality of life for those members that is living with the disease. Some of the other aspects, as you can see, and to the point around diabetes management, which is a disease that we particularly pay attention to, is to ensure that we are able, through health screenings, our wellness programs, able to identify those members that might not even know that they are at risk of diabetes, to enroll them, to coach them, to provide one-on-one access through telephonic support, to be able to live a better quality of life when it comes to diabetes. And in that sense, we've enrolled 14.4% more members onto the program, now taking our total tally to just over 17,000 members. And we will continue to do that in terms of disease management and preventative programs to ensure that as a scheme, we are not only there for our members in terms of sick care, if I can utilize that phrase, but also that we are able to proactively do preventative care for our members in terms of ensuring that they've got access to quality health care. Definitely a brand that you want to be associated with in terms of healthcare. It would be remiss of me as I get to the end not to talk about COVID and where we are right now. As we know, the COVID pandemic has impacted all of us and hasn't left anyone untouched. But key from a scheme perspective is that we've got a dedicated focus in terms of managing the pandemic, and we will continue to do so. In terms of the slide that's currently up is an overview in terms of where South Africa is in terms of pandemic, and this is frequently and almost daily and hourly reported through our various media channels. So I will not spend too much time on it, but I will fast forward in terms of what this means within the Bonitas world. From a COVID-19 perspective, we have done close to 185,000 pathology tests. This is establishing whether members are positive or negative with the virus. We had just under 34,000 members to date testing positive. We had 8,000 hospital admissions, and unfortunately have to report 1,123 fatalities at our last reporting period. But in terms of our actions to protect the lives of our members and to ensure that they have got access to the necessary quality of care, that has been countless, and we are pleased and will continue to ensure that we are able to, that we are focusing on it while we're actually navigating the road in the pandemic. How have we done that? We have done that through member support, through waiving of co-payments, as we know that some options require co-payments. We have introduced a COVID hub, and I want to encourage you, if you have not utilized it, on our website to visit the COVID hub, where you're able to get a wealth of information around being able to assist you when faced with questions around COVID. We were also one of the first to pay for PCR tests during the onset of the COVID pandemic last year. We adjusted benefits, and we committed ourselves, even pre-government declaring it a PMB, that we will ensure that our members have access to a vaccine when it arrived. And to that point, and perhaps if I can just pause, I would like to encourage members to gather information, the knowledge that we provide, to make an informed decision around vaccinating. I have personally committed myself to taking a vaccine, but we would like to encourage all our members, as soon as possible, to have access to the vaccine as the age categories are rolled out, so that we are able to beat the pandemic and return to normal. In terms of the current latest stats, once again in terms of demonstrating value, to the right-hand side, I want to illustrate that the scheme has funded close to about 33 million rand already in relation to vaccine cost. In terms of hospital admissions currently, we are a total of 18,000 members hospitalized. So as you can see from the statistics that's on the slide, it remains a key focus area for us as management, our service providers, to ensure that we are able to beat this pandemic. Just in short, some of the aspects that we currently have to consider as we deal with the COVID pandemic, the costs associated with it, taking care of members. Broadly, from a macroeconomic perspective, we have to consider these aspects such as the economic climate in terms of the SA landscape, as I've mentioned, and Luke will touch on it. We're very mindful in terms of the psychosocial impact that it has on members and their families and in the workplace. And through our programs such as mental health, we will continuously strive and partner to ensure that we are able to address those type of risks. We're also very mindful in terms of the competitive nature that is existing in terms of from a cost perspective, and through our research and market analysis, we will endeavor to ensure that our benefits and our pricing remains competitive and adds value as we drive the issue, or as we address the issue of affordable healthcare within the private sector. But with that said, in the background, things such as regulatory changes, as we know, topics such as national healthcare is critical. We remain focused in terms of being an active player and contributor in terms of shaping that regulation. And on that point, as a scheme, we firmly believe that access to universal healthcare is important. The question just is in terms of how we do it to ensure that people remain informed, but also once it actually takes place, that it is a solution that best serves the entire South African population, both private and public. In conclusion, to just re-emphasize what our chairman of the board indicated, our duties, we will continue to focus in terms of delivering our work with due care, with diligence, skill and good faith, and act at all times in the best interests of our members as we consider all these variables that I've alluded to in the report back as we make decisions for the scheme and for our members. Chair, with that said, the commitment that I want to leave our members with in terms of what you'll see also in our financial reporting is that we will continue to grow the scheme in terms of membership so that we remain financially sustainable. We will continually endeavor to ensure that lowering of healthcare costs takes place. Further to that is to manage clinical risk for those members that access care in terms of their illnesses, and that is important to improve our members' quality of life and the broader healthcare status of South Africans. And finally, as I've mentioned, the improving of quality of care is important as we engage with our service providers to ensure that we continuously innovate and provide the relevant healthcare at the cutting edge of what's happening in the world for our members and for South Africans. With that said, Chair, thank you very much, and thank you very much, members, for listening to the report back from the Board of Trustees for the year that has passed. I'd like to hand back to you.
Thank you, Lee. The next agenda, item 3, relates to the independent auditor's report. I will hand over to the audit partner from Deloitte, Ms. Penny Beanie. Penny, the floor is yours.
Thank you, Chair, and good morning to the members. It's both a privilege and a pleasure to be here in front of you today. On the screen, you'll see an extract of our independent audit report for the year ended December 2020. Shortly, you're going to hear from Luke around the financial results for that period, and my job is to give you as members comfort that the numbers that Luke talked about are fairly stated. I'm pleased to say that once again, as Deloitte, we've put together an unqualified audit opinion for the 2020 year end, with a key focus area being the determination of the incurred but not reported liability. And once again, we closed that out sensibly. I think as members, you can take a lot of comfort from the sound internal financial controls operating within the scheme, the sound governance, and the really very constructive approach to achieving accurate financial reporting. Once again, I thank you for appointing Deloitte last year for the 2020 year end, and with your permission and hopefully with your support, we look forward to delivering the audit for December 2021. Thank you, Chair.
Thank you, Penny. The agenda item 4 is a synopsis of the audited financial statements, which is for noting. This will be presented by the Chief Financial Officer, Luke Woodhouse. Luke, the floor is yours.
Thank you, Chair, and good morning to our members. I'm delighted to present an overview of the 2020 financial results. However, before we get into that, I'd just like us to take stock of 2020 and how it shaped the financial landscape in which we operate as a fund. 2020 was a year that we will never ever forget. Over and above our concerns around our own health, the swift and massive shock of the pandemic and the lockdown measures plunged the global economy into a massive and severe contraction. Major indices and stock markets around the world contracted by almost 30% in March 2020 as panic selling took hold. And South Africa was not immune to this global financial crisis. In 2020, the South African economy contracted by 7%, which was actually the largest annual decrease in GDP since the end of World War II. And this obviously had a big impact in unemployment numbers, and unemployment numbers reached as high as 30%. So, Lee has already spoken to the growth that we've seen in the fund. So despite the fund contracting by only 1.7% in 2020, relative to the decline in the GDP, it just shows that the fund remained particularly attractive to members and the resilience of our members to stay on healthcare. The good news really is that we've seen a strong recovery, particularly in Q1. GDP numbers improving by 4.6% in Q1 of 2021. And really a lot of that growth happening in the mining sector. Now, Bonitas has a very strong membership base in mining, and a lot of the growth that Lee spoke to in the early parts of 2021 actually did come from the mining sector. We're very pleased of our core focus there. But we really have good diversification across a large number of sectors. And that's largely why Bonitas as a medical fund was able to weather the storm of the economic downturn in 2020. Just touching on markets and equities on the JSE, which is obviously a crucial indicator for our investment performance. Equities, as you can see in March, really plummeting, almost like a roller coaster, where they dropped almost 30% down in March. But as you can see, very encouraging that the markets have also shown some resilience and have bounced back. And if you have a look in December, at the end of that graph, 2020, the index really almost in line with what it was pre-COVID-19. And the fund invests some 30% of its investment portfolio in equities. So it was crucial that our equity exposure was actively managed over the course of 2020. We were very successful in that regard, and I'll show you the investment returns that we were able to achieve for our members. So with all that in mind, I'm going to move to the fund's performance for 2020. And these are some of the bigger financial indicators that are crucial to the fund. And I'll start there at the bottom left there with the claims loss ratio, which indicates 83%. Now, generally, Bonitas would report a claims loss ratio around 91%. You can see 2019, the figure of 92.3%. So 83%, significantly lower than what we would normally see. And really the reason for that is that during the lockdown measures, members stayed at home and didn't access the healthcare sector unless they were going in for COVID-related issues. So we saw massive spikes in COVID-related expenditure, but actually on non-COVID-related spend, that dropped by a large amount. Also, hospitals had capacity constraints, and they were only able to deal with COVID-related issues. So, elective surgeries and procedures were cancelled by hospitals, and hospital costs are the biggest driver of healthcare spend in a medical fund. So, with that drop-off in the non-COVID utilization, it really drove our overall claims ratio down to 83%. And I'll go into a little bit more detail on that on the next slide. But really, that together with some very good managed care initiatives that we implemented, particularly in chronic medicine, actually helped us achieve the highest recorded surplus in Bonitas' history, which is the 1.7 billion there. Relative to 2019 of 186 million. Just some other indicators. Our credit rating has just been affirmed by Global Credit Rating. It was published recently, earlier this week, has been affirmed at AA-. We're very pleased with that rating. However, the rating that was published, the review that was published, actually states that, should the amalgamation with Ned Group occur, there is a potential for Bonitas to move to a AAA rating. So we're very excited about that prospect, and hopefully within the next 6 months we can move to AAA rating. In terms of our non-healthcare spend as a percentage of risk contribution, for 2020 we reported 8.9%. It reduced from 2019 of 9.2%. Very proud of that percentage. It is one of the lowest in the open scheme industry, and we apply a lot of financial discipline in terms of managing that non-healthcare spend, because really that allows us to plough more funds back into the healthcare line and pay additional claims for our members. In terms of our investment income, I'm going to go into a little bit more detail around that in the next couple of slides, but a very healthy 313 million. Unable to obviously reach the same number we did in the previous year, but as I mentioned, the massive global financial crisis that occurred during this year, we're very pleased to report returns in excess of CPI. We increased the number of our surplus generating options from 2 to 8, and that remains an ongoing focus for us going forward. And then our contribution income increased by 6.3% to 17.8 billion. So the scheme, closing in on that 20 billion rand mark in terms of premium income. Okay. I spoke a little bit about the claims loss ratio being driven down to as low as 83%. So I just want to give a little bit more context to that. And you'll see there the grey line that runs along the top of the graph, indicative of the types of claims that we would see pre-COVID. So that's actually the 2019 claims ratio. And it generally runs, from 93% to 96 and down to 92. So, we would normally budget and forecast for around a claims loss ratio of 91%. However, as you can see, for 2020, claims ratios, for January and March, very much in line with pre-COVID, and then, COVID taking hold in April, and you'll see the claims ratio plummeting down far lower than previous levels. The orange percentages are the amounts that are specifically pertaining to COVID. So you'll see them growing throughout the year as a percentage of the overall claims ratio. But really, the largest surpluses for 2020 as a result of that huge gap, as you can see in April, May, and June, where claims loss ratios were significantly lower than 2019. Okay. This is just a graphical representation of the change in our reserve, the surplus relative to previous years. So Bonitas is not in the business of generating massive and significant surpluses. That's not what we aim to do. We aim to try and achieve a small surplus to fund the growth and the claims that are relate to that growth on the fund over a course of a year. So generally the scheme would budget for low surpluses around a couple of 100 million rand. Of course, due to the matters that I've already spoken to, and the reduction in the utilization of the period in 2020, those conditions resulted in this massive surplus in 2020. So that ultimately, drove the solvency ratio up from 25.2% in 2018, where we dropped to 24.9 in 2019, is now radically increased and improved to 32.7. So it puts us in a very healthy position. It was unexpected, but it is certainly a very healthy position for the fund to find itself in, and gives us a lot of leverage and ability to actually pass those benefits now back onto the member, whether that be through contribution, lower contribution increases, or benefit enhancements, etc. Okay. Just want to show the fantastic improvement that we've had on our investment base. So in 2018, we reported in 4.3 billion rand in investment reserves. Our entire portfolio, excluding cash and cash equivalents, totaled 4.3 billion. It's now sitting at 6.1 billion, and really that's down to the new strategy that we've employed on our investment portfolio, which is a strategic asset allocation approach, whereby we've split our portfolio up into specific categories, and we have asset managers who specialize in those specific categories, and we track those relative to benchmarks on those category of instruments. It has proved very successful for Bonitas since employing that strategy in 2018. And you'll see, the return in 2018, 3.7, moving up to 6.7%, and 4.2% in 2020, actually very high, considering the fact that interest rates over that period dropped by 3%. So we were very pleased, and in fact, some of the industry data that we've looked at shows that Bonitas is one of a very few schemes that actually reported investment returns greater than CPI. CPI for that period around 3.3%. And then just the rand values of investment income on the right-hand side, but you can see some large improvements there. Okay. Just a snapshot of our actual statutory income statement, so you can see it in the actual flesh. I would like to direct our members to our website, where our integrated report is available. There's some fantastic information around the scheme and strategy, where we're going, our governance structures, etc. And included in there is obviously our financial results. This statement of comprehensive income, as you can see, illustrates that large surplus of 1.7 billion rand in 2020. A couple of things I'd just like to highlight. The risk contribution income, as I mentioned, increasing by 6.3% to 17.8 billion. And if you have a look at the net claims incurred number of 14.3 billion. So relative to 2019 of 15 billion, significantly lower. Now we would generally see that claims figure increase by CPI plus an amount of at least 3%, because healthcare inflation far exceeds normal CPI numbers. So for it to actually contract, gives you an indication that something unprecedented happened in 2020. We also had some very good negotiations with our capitation providers, and we were able to recoup close on 100 million rand due to the low utilization levels in the dental and optical space. So we're very pleased that we were able to put some money back in, and that's the 126 million there relating to the net income on risk transfer arrangements. Investment income I've already spoken to, and really our administrative expenditures, the other one I'd like to note. If you have a look at 2019 at 1,217 million, only increasing by 3 million to 1,221 million. So, you know, despite inflation, we're actually able to restrict the increase in administrative expenditure, and Lee did speak to some of that earlier. Okay. Then just going forward, because I think, you know, as members, you'd want to understand, you know, this the impact of COVID on the fund going forward, because as I mentioned, you know, there is a catch-up happening in terms of people starting to claim again, elective procedures, etc. And there is, without a doubt, that pendulum is starting to swing back. And this slide indicates the relationship between COVID-related expenditure and non-COVID related utilization. Now, when the orange bars at the bottom exceed the red bars, that would be indicative of a situation where we're actually producing surpluses in excess of what we would budget for. So you'll see as it runs through to December, a lot of those orange bars are exceeding the red bars. So the reduction in utilization for non-COVID far outweighs the projected costs of COVID, and that's why you have a surplus position. Now, moving forward, you'll see in January, the second wave, that actually wasn't the case. The COVID-related costs almost on a one-for-one basis with non-COVID utilization. And then moving forward, you'll see there in June, the red bar now actually starting to exceed the orange bar. So we do need to be very cautious. There is certainly an additional take-up of healthcare, which we knew was going to happen. And we need to remain responsible in terms of how we price our contributions going forward, and that is exactly what we're going to do. So just to wrap up, I think, you know, on the whole, a very large improvement in the fund's solvency, its ability to remain sustainable. We've shown some numbers in terms of our membership and how we're actually managing to grow in the face of an economic downturn. So really a very good position for the fund to be in and for its members. Thank you, Chair.
Thank you, Luke. The agenda item 5 is resolution number 1, whereby the Audit and Risk Committee is responsible for recommending to the AGM the appointment of the auditors for 2021. I would like to ask Mr. Pierre van der Nest, in his capacity as chairperson of the Audit and Risk Committee, to present their recommendation in respect of the appointment of the auditors for 2021. The floor is yours, dear Pierre.
Thank you, Chair, and good morning, members. The Audit Committee, as a subcommittee of the Board, has the responsibility to evaluate and recommend the appointment of the external auditors for Bonitas. We have reviewed the financial statements and the audit report. The audit process went very well, and we are comfortable with the level of assurance that we have received from our auditors. The Audit Committee has also assessed the independence of the external auditors. The Audit Committee has recommended the appointment of the auditors, and the Board has concurred. So in terms of Resolution 1, we would also like to recommend to the AGM today the appointment of Deloitte as the external auditors of Bonitas for the financial year ending 31st of December 2021. I thank you, and back to you, Chair.
Thank you, dear Pierre. The agenda item 6 is resolution number 2, whereby this item on the agenda relates to the proposed amalgamation with Net Group Medical Aid Scheme. We have prepared a few slides to provide insight to our members. Please note that the full exposition document is available on the Bonitas website for review. I will hand over to Lee to take us through this. The floor is yours, Lee.
Thank you very much, Chair. In relation to Resolution 2 that members are required to vote on today, which is the proposed amalgamation of Bonitas and Net Group Medical Scheme, as indicated by the Chairman of the Board, we've prepared a few slides to provide context, but second of all, and to reaffirm, is that the full exposition document is available on our website for members to consider. In relation to the synopsis around what this amalgamation would mean for members and would it be in their best interest, if we consider in terms of some of the numbers associated with it, Net Group Medical Scheme is currently a membership base of just over 26,000 members. And should this amalgamation be favorably voted on, as well as approved by the regulator, it would mean that the membership would grow to 366,000. That would by far make Bonitas the second largest open medical scheme in South Africa, which is very favorable from a growth and a development perspective, as I indicated under the strategic report back on the business development pillar. However, with that said, I must qualify that this amalgamation does allow Net Group employees to be able to make a choice of joining Bonitas or two other options. However, Bonitas was selected as the primary amalgamation partner. That's the reason for the process that's undertaken, which I will share in the next slide in terms of what the next steps are. Further to that, from a solvency perspective, and we have heard from the CFO in terms of the solid solvency position that the scheme is currently under, based on our forecast and based on the amalgamation of these reserves joining Bonitas, it would further strengthen our solvency position to 35.6%. In terms of average age, as I've mentioned, why this is important is in relation to our pricing as well as our benefits and our entire financial model, is that the amalgamation would not have any negative adverse impact in relation to what we have reviewed in our actuarial review and also contemplated by our Board of Trustees, is that the average age would be 48.5 and our pensioner ratio would actually remain unchanged, which is illustrative that the amalgamation would not adversely impact the Bonitas membership. In terms of from a process perspective, the board of both Bonitas as well as NAMAS, or the Net Group Medical Scheme, have resolved that the schemes should amalgamate based on integrating specifically reviews that has been done by independent actuaries as well as the scheme's own actuary. The resolution is necessary for the process to be taken further as required by our scheme rules. The members have to be asked to consider specifically the transaction and exercise their vote in respect thereof. The transaction, if it receives the approval of our membership of the scheme and from the relevant regulators, which includes the Council of Medical Schemes as well as the Competitions Commission, it will result in NAMAS being integrated into Bonitas Medical Fund with a proposed effective date of 1st of January 2022 or such other date that may be determined by the regulator or any legal processes. What you'll also see on the slide is just an illustration in terms of where we are in terms of process and the anticipated process going forward. But just to reaffirm, and what you'll see on screen and available on our website, is that the exposition document is available for you to study in more detail to illustrate what has been considered by the relevant boards in making this decision and proposing to you for this amalgamation to go forward. In terms of the process and the steps where we are, resolution has been taken by the board. The exposition document, as I indicated, has been completed and available for review. That has also been submitted to CMS, and the exposition document has been in principle approved, which resulted in a regulatory process of advertising publicly for broader stakeholders to be able to review, first of all to receive, to review, and to provide their commentary on it. And that has been done in national newspapers, and this coming Friday it will also be published in the Government Gazette. Obviously today we're at a key milestone, and that's the reason for the resolution, and the agenda is for our members to consider and to vote on this process. Once that is completed, it will be submitted to the regulator, which will then apply consideration to it for approval, which will then followed by a submission to the Competitions Commission. And hopefully, as I indicated, our indicative date, if all is approved, both by members today as well as by the regulatory authorities, it would be then, the amalgamation would then become effective on the 1st of January 2022. Chair, with that said, that's an overview, and I trust that members will be able to take any further detail and consideration of the documents that is or the information contained in the exposition document available on our website. I would like to hand back to you. Thank you.
Thank you, Lee. Members, the voting was opened on the 11th of August 2021 to allow members to cast their votes on the two resolutions via various platforms, including WhatsApp, the Bonitas mobile app, USSD, the Bonitas members portal, or the e-voting platform. We have allowed for the voting to continue until 1600 hours today and will close the platform thereafter. PwC will then verify the voting and advise the scheme of the voting outcome. The outcome of the voting will be published on the Bonitas website by Tuesday, the 24th of August 2021. During the course of the meeting, questions have been posed to the AGM. We will now play a short video to consider the questions and to present as many answers as possible after the video has finished. Thank you for the questions raised by you as members. I will now hand over to the executive for them to be able to respond to the questions as put forward by yourselves. The first question will be handled by Luke. Over to you, Luke.
Thank you, Chair. The first question is, why are funds depleted towards the end of the year? So, a full basket of benefits is provided in advance to members on the 1st of January each year, and this allocation is based on receiving contributions for the full year. Therefore, if you deplete your day-to-day benefits before the end of the year, you will still have access to risk benefits such as hospital cover, and you need to continue paying for this.
Thank you, Luke. The next question that we have is as follows. Why does the medical aid reject some chronic medication even when they're prescribed by their doctor? First of all, the medication entitlement is really determined by the member's option on which they're at. The medical scheme, or Bonitas, does not determine really in terms of what medicine can be utilized, but rather in terms of what is being paid for and what will be covered by the scheme. With that said, we welcome you to utilize any one of our channels to be able to understand your query better. So please reach out to us via one of the contact channels. The next question that we have is, are the COVID-19 vaccines covered if I'm a Bonitas member? Very pleased to say yes, the vaccines is totally covered by the scheme. That includes the actual vaccine cost as well as the administration cost that goes along with it. So it is fully covered, and that comes out of a separate risk benefit in the member's benefit option. Then allied to that question also is in terms of what is the approach or the process to be followed if I want to be vaccinated. Very good question. So as we know that government has set out protocols associated with when members or when South Africans can access the vaccine, and that is based on age. So as age categories open up, and we now in the age category of 35 plus, members are able to go onto and through the Bonitas website, onto the government's EVDS system, register and enroll. And based on that, they will receive a confirmation SMS that will advise them in terms of at which venue they're able to be vaccinated. Very good question. The next question that was asked is, I hope that the amalgamation will not have a name change. Very pleased to say that that would not be the case. The name that will be retained post the amalgamation is that of Bonitas Medical Fund. There's also an additional question in relation to that in terms of what is the possible pros and cons associated with the amalgamation. Unfortunately, we are unable to unpack that in greater detail because there is a lot of detail involved in that answer in terms of what we have considered as a scheme and what the Board of Trustees have considered. That detail in terms of the advantages and disadvantages is clearly articulated in the exposition document. So I would like to direct you to the exposition document on our website to be able to read up on all of those aspects that is set out in terms of advantages and disadvantages. I think that covers all the questions that we have time for right now. So Chair, I would like to hand back to you.
Thank you, Lee. Members, due to personal information contained in certain questions, those questions which have not been answered will be dealt with appropriately, either through direct interaction with a member or otherwise through publication on the website. The recording of the AGM will be available on the Bonita website in due course. We have arrived at the time whereby I wish to thank all of you who took the time to attend this AGM. As a scheme, we will always continue to act in the best interest of our members. Stay safe. I declare this AGM closed. Thank you.